Looks simple to treat HIV now after so many years of improvement in therapies. We have so many antiretroviral drugs, and we can definitely offer many things. I always tell my patients, you have sort of come to a cafeteria, and I can offer you a mocha or cappuccino or whatever you like. But then, once the patient starts taking treatment, the other problems also start. First of all, of course, it is very difficult to choose that which medication should be given, because if the patient is on other medications also for, say, diabetes, hypertension, or whatever, then you have to choose your antiretrovirals. I can always answer the questions when and what to do. If the patient is already pregnant, if the patient is old, all those things. But now let us imagine a young man has come to you who is unmarried and is unaware how he got the virus, and first of all he remains in a lot of mental conflict and try to find the reason that why and how he contracted the disease. Now go ahead. Everything is good. You have counseled the patient. He has started taking antiretroviral drugs. But the next problem is now, and he has survived another 1 year, 2 year. The question of surviving is over. Now he's living, but now he wants to live with the disease. And live means live. If he's unmarried, he wants to marry, he wants to have children. And these are the things we have to take care of. If a HIV positive person on antiretroviral drugs want to marry, then can he marry? Who will marry him or her? How will it go? Will you allow him sex? If he falls in love with a person who is not HIV positive, there are many ifs, many buts. But we, as their doctors, counselors, counseling is not a one-time job. Everybody of us knows. It has to go on and on and on. So we have to provide those answers that how will be the marital life of such a person. That means the serodiscordant couples. How do we tackle them? And then once we do that, I'm sure all of you must have faced this situation that once the patient is married, a HIV positive patient, then the couple wants a child. Now, how can we help him having a child? I have many patients whom I could advise that they can have a surrogacy or a washing of the sperm, but how many places it is done? This is one important issue. Whenever you ask any question about this, I'll try to reply them. Then the issue comes that supposing this patient gets an injury. Now, who is going to operate? Will the doctors? I tell you many a times, most of the hospitals, most of the consultants reluctantly trying to find excuses, crutches, take this crutch or that crutch and try to shoo away these patients. Now, this is very, very difficult scenario. The other difficult scenarios are patient develops, say, appendicitis, patient develops, say, benign hyperplasia of prostate, many other things like this. And then how do you tackle them? That's another thing. Now, this is all living, they're living problems, and they not necessarily affect only the normal people. Even the HIV people on treatment, doing well, can get all those things. I'm not talking of depression that continues for quite some time because of the medicine intake, which has to be regular. The situations also come when such a patient dies. And once this patient dies, you will know that family will ask, can we give the ritual last time bath to the patient? That reminds me, even while the patient is living, family members are initially very skeptical whether, if it is a lady, whether she should cook for the family or not. If she is cutting vegetables and get blood and cooks the vegetable for everyone, what next? Forget. Now I have come to the death. Now, rituals is one thing. Second thing is, if the death is unnatural, the hospital and doctors I have seen going jittery, that how to do the autopsy, and sometimes to know how to preserve the body if the last rites have to wait for the arrival of a son living in a distant country. All those things. So this is the initial I have given. You ask me questions and I can reply.